Rohingya refugee camps confirmed its first coronavirus case. Authorities said that 2 people, including a Rohingya refugee, have tested positive for the coronavirus. The other patient is a local who stays outside the camp in Cox's Bazar.
According to the government of Bangladesh, 1 Rohingya refugee has tested positive for COVID-19 in the Kutupalong refugee settlement in Bangladesh. In addition, 1 member of the local Bangladeshi host community has also tested positive. Both had approached health facility run by humanitarian partners where samples were taken. There are serious concerns about potentially severe impact of the virus in a densely populated refugee settlement sheltering some 860,000 refugees. Another 400,000 Bangladeshis live in the surrounding host communities. These populations are considered to be among the most at risk globally in this pandemic.
Bangladesh's Cox's Bazar is home to the world's largest refugee settlement. The camps have a population density of nearly 70,000 people per square kilometer. It's a mammoth task for authorities to trace the people that the coronavirus patients come into contact with. Even if that is done, it will be difficult to quarantine these refugees as families live in crowded spaces, often sharing tents. Then there's a lack of sanitation. The Rohingyas who began arriving in Bangladesh in 2016 after fleeing persecution back home in Myanmar have nowhere else to go. Joining us on this broadcast is Professor Imtiaz Ahmed, who's joining us live from Dhaka. Professor Imtiaz, it's a humongous task for Bangladeshi authorities because if they do not contain this outbreak early on, then it could really get out of hand, isn't it?
Yes, it could. But the very first week, way back in March, authorities were absolutely concerned from that very first week. So over the weeks, I think they have a plan. A special hospital has been made. As you have said, they have already removed to a different location 2,000 people. So they have been working on this. It's not like that. Yes, it is still a challenge. No doubt about it. You know, if it is 40,000 people per square mile, you can see the largest camp in the world now. It's the biggest challenge. But so far, since it's limited to 1 plus 1, and the authorities have already moved in, so we just have to, keep looking at it and keep our fingers crossed.
Absolutely, it is a challenge. First of all, you'll have to identify the patients who have the coronavirus. Then you'll have to identify those who came in contact with, and with the population density, how do you isolate those people? And Bangladesh itself is facing a shortage of medical equipment. We are learning that there are only 2,000 ventilators in Bangladesh. And there are 160 million people in Bangladesh. Plus, there is an outbreak now in this world's largest refugee camp. So can Bangladesh actually deal with such a crisis if it gets out of hand?
It's a good question. Well, so far, if you look at the casualty figure, it has been relatively low. Yes, you can get infected, but then it would depend how serious the patient would be. Not all would require ventilators. That's a point. So we are hoping that those who will be, there will be more infections probably, that it will not be of a severe case. They have already made special hospitals for severe case also, but with one case they have, as I said, already shifted 2,000 people, which means that they know what needs to be done. But, given the world scenario, given Europe and the US and some other countries, one can see it's a big challenge. And as I said, we just have to keep our fingers crossed. But authorities are prepared and doing whatever that is required.
One final question, Professor. One final question. More than 730,000 Rohingya arrived in Bangladesh in 2017, fleeing persecution in their own country. Is Bangladesh expecting international bodies to step up with aid?
Well, they ought to, in fact. There is no reason they shouldn't. But it's not only the aid that's going to, resolve this issue, or, you can contain the plight that they are going through. I think there has to be a bigger pressure on Myanmar. That somehow is still lacking. Much bigger pressure, particularly after the ICJ ruling, which has clearly, used the word Rohingyas, and already we have an agreement with Myanmar that they will be repatriated. But somehow Myanmar, for one reason or other, is not really serious about the repatriation also. The gaze ought to be on Myanmar, and we hope the international community will do, particularly with the pandemic that we now have, that they will build the pressure of a bigger one, so that they can go back to their homeland.
Professor Imtiaz, thank you so much for joining us. And the world is hoping that this outbreak in this Rohingya camp really does not get out of hand.